been some fantastic news in the UK with regard to the chickenpox vaccine. It's going to be available on the NHS to children between the ages of 12 and 18 months. This is hugely important because chickenpox for a child is often a mild infection. It's very unpleasant with the itching and potentially can lead to scarring from the rash. However, it's very rare that we get complications from chickenpox. The problem with the virus that causes chickenpox, which is varicella zoster, this is a herpes virus and it is what's known as a latent virus. So when you get the infection, your body never clears it. Now what that means is that the chickenpox virus, your body deals with that primary infection and then it goes quiet, living in your nerves until potentially you become ill for something else, have issues with stress, or become older and your immune system is less able to keep that latent virus in check, in which case it can resurface as a very painful skin condition called shingles. Now there we get an outbreak of what looks very similar to chickenpox, but in one dermatome, an area where a nerve feeds an area of skin. Now that's not just chickenpox resurfaced. Shingles is much more painful because of the damage that occurs to the nerve and crucially can leave patients with something called post-herpetic neuralgia, an ongoing permanent pain in the area where that rash appeared. And because it's a neurological pain, doesn't respond to standard painkillers. So on the child side of things, the ability to get this vaccine on the NHS is great because it means they won't get chickenpox. But actually it's hugely important for long-term health because it will mean that these immunized children should never go on to develop shingles, which is a massively problematic condition as and when it occurs. So great one for the NHS there. Take care and we'll see you in the next one. Cheerio.